Thank you for joining us for Memorial Healthcare's Community Conversations. In this weekly video, experts from Memorial Healthcare will answer your questions about how we're caring for our communities during the COVID-19 pandemic, and also update you on new services and offerings at Memorial Healthcare. Our greatest responsibility is the health and safety of our patients, staff, and community. That's why we are committed to keeping you informed and prepared. Today we are joined by Megan Smith, Associate Vice President of Quality and Safety, and also Kevin Davis, Associate Vice President of Operations. They will be sharing information with you on how we're keeping our patients and employees safe during this unprecedented time.
Yes, so some people may experience no signs and symptoms of COVID. Others may have mild symptoms and some more severe symptoms. So it's important to be aware of what the signs and symptoms to monitor for are. So some people may have a cough, a sore throat, some shortness of breath or difficulty in breathing, a fever, chills, body and muscle aches, a new loss of taste or smell, and some may have a headache. You may also experience nausea, vomiting, diarrhea, or fatigue. If you feel that you've been exposed to someone that has tested positive for COVID-19 or potentially is positive, it's important that you contact your primary care physician and consider being tested for COVID. If you do develop mild symptoms, it's also important to contact your primary care physician or go to a testing location to be tested or seek care at the urgent care or emergency department. If your symptoms become more severe, such as difficulty in breathing or shortness of breath, you would want to go to your nearest emergency department or contact 911, and if possible, contact them before arriving to give them a heads up of your symptoms. So if you have been exposed or experience any signs and symptoms and being tested, it's important that you self-isolate until you know your results of your COVID test. And then once you receive your results, if you are positive and have no symptoms, you need to continue to self-isolate for a minimum of 10 days from the date that you tested positive. If you do have symptoms of COVID-19, you need to be sure that you continue to self-isolate for a minimum of 10 days from the onset of your symptoms and until you've been fever-free for at least 24 hours without any fever-reducing medication such as Tylenol or Motrin. And make sure that all of your symptoms are improving, and of course be sure that you've been cleared by the health department.
At Memorial Healthcare, our primary focus is safety. Safety of our patients, safety of our visitors, safety of our staff, physicians, and also safety of the community. And at Memorial Healthcare, we accomplish social distancing in several ways. One way in which we do social distancing is by protective barriers in our waiting rooms. These barriers give a protective shield between patients should they have to wait in our waiting areas. Another way we do that again in our waiting areas is through spacing of the chairs around those barriers. So chairs are spaced at the minimum 6 feet apart. So there's ample social distancing with the protective barriers while you are in our waiting rooms. The second way we do social distancing is by actually decreasing the amount of time patients are in our waiting rooms. One way is through pre-scheduling visits. Before COVID, for laboratory and radiology visits, a lot of it was walk-in. However, now we highly encourage patients to pre-schedule visits. This way they can walk in and it minimizes the time that they spend in the waiting room. Another way we do social distancing is through having patients wait in their vehicles for their scheduled appointment. So rather than spending time being exposed in a waiting room, you spend time in the private safety of your own vehicle, and then you are texted or called on your cell phone when it's time for your appointment. Then you can just walk right in and then receive your lab or your radiology appointment. The other way we do social distancing is through telemedicine visits. All of our MMA providers provide telemedicine visits, which allows the patient to be at home in the safety of their own environment while receiving a physician evaluation.
At Memorial Healthcare, we do our COVID-19 testing right here in-house. And generally, we have results back within 24 to 72 hours, and you can access your results by going to the patient portal. You can find the patient portal on the Memorial Healthcare website and click on the tab that states Patient Portal. If you're interested in having a COVID-19 test, contact your primary care physician. You need to have a valid reason for the testing, such as a known exposure or symptoms of COVID, and an order by your physician for this to be covered by insurance.
At Memorial Healthcare, we have implemented several strategies for enhanced cleaning to provide a sanitized area for patients and visitors and staff within our environment to keep people safe. One thing we do is every evening we perform a high-level disinfectant fogging of all of our key high-traffic areas. And this includes all of our waiting areas, our common hallways, and this is performed nightly. And the solution that is used is, again, a high-level disinfectant fogging that is extremely effective at fully eradicating any of the COVID virus that might be present. And we also have enhanced cleaning efforts just by our housekeeping crew, that we've expanded our housekeeping crew, and they do much more general cleaning in between visits throughout the day, again with the goal of providing a sanitized environment as much as possible.
That's a great question, especially as schools start to resume in-person classes. And so I would recommend that you closely monitor for any signs and symptoms, and should he have any, then I would recommend contacting your primary care physician to consider being tested for COVID-19. And the other option is to also wear face coverings when they're having the interactions by both parties. So your son and the grandparents should both wear a face covering. We continue to monitor the risk of communicable diseases such as COVID and influenza on a daily basis, and we will adjust our policies and procedures as necessary.
We have implemented many new procedures to protect against the spread of COVID. And as the first one, as Megan talked about earlier, is face coverings. We mandate face coverings for all visitors, staff, anybody coming into our environment. And the face coverings are a key protective measure that protects the spread from other people. If you have your own covering, we encourage you to bring your own face covering. However, if you do not have a face covering, we openly and willingly provide face coverings to you. Another new procedure that we have implemented is screening. We screen all of our staff every day before they report to work. We screen all of our physicians every day before they come into work. And then we also screen all of our patients before they enter the environment. This screening is very effective at providing a safe environment. Another new procedure we implemented is with our surgical patients. Any patient coming in for a surgical procedure is pre-screened for COVID with a formal COVID test before they come in for the procedure. And what this does is effectively protects the patient, but also effectively protects other patients that are inside the hospital, as well as our staff, preventing the spread of COVID. Another new procedure that we have implemented is testing all of our new patients that are newly admitted. And what we find is that through this formal COVID test of all patients that are admitted, it helps identify any patient that may present without symptoms. One key strategy that's very effective at preventing the spread of COVID is by staff wearing personal protective equipment, which we term PPE. And the key to PPE is making sure that staff know how to put it on, take it off, and wear it appropriately. That's one key that we have found, is that because if it's not worn and used appropriately, it isn't as effective as it could be. So Memorial has put extensive efforts into fully training all of our staff. We realize that some of these changes may pose a minor inconvenience. However, they have been put into place for your safety, and we appreciate your patience and understanding.
Thank you for joining us today. If you have a question for Memorial Healthcare's team of experts, please visit our website at www.memorialhealthcare.org to submit a question. We will do our best to answer these questions on our weekly videos or in one of our frequently asked questions updates. We ask that you visit our website or follow us on our social media platforms to get up-to-date information. Memorial Healthcare. We're here, we're ready, we're keeping you safe.